Rapid Fire Endocrinology Edition. I'm here with Dr. Ann Peters. She's a full professor of medicine at USC Keck Medical School and one of the world experts in diabetes management. Question, would you say that you know as much, if not more, about GLP-1 drugs than any doctor in the United States?
Yes.
She's going to tell us everything you need to know. Type 2 diabetes, reversible, true or false?
False. Because it's always with you. Whatever the risk for complications you got when you had it are still there. You can put it into remission, but it will come back if you don't mind your habits.
GLP-1s, poison or miracle for most people?
Neither. They're really good medications and need to be used in the context of a healthcare provider who knows what they're doing to be sure you don't get side effects that can cause problems.
For the record, you are not paid one penny by Eli Lilly or Novo Nordisk.
Nope.
Do you believe in GLP-1s for prevention, i.e. for people who do not yet have type 2 diabetes?
Yes. Preventing type 2 diabetes largely means losing weight in people who have prediabetes who are overweight. And these drugs are great for helping with weight loss. But again, I'm a believer that each person with prediabetes needs to be individually assessed and then treated accordingly. Metformin could be helpful. These drugs, though, in the trials are actually quite effective.
Continuous glucose monitoring for people who do not have type 2 or type 1 diabetes, helpful or fluff?
Helpful. So I put CGM on everybody, including my dog. I think you get real insights into your metabolism. You've got to know what you're looking for. People find all sorts of interesting things. You look at the data, you can make big changes.
GLP-1s like semaglutide and side effects. Thyroid cancer, significant risk or not?
Not in humans.
Bone loss and muscle mass loss with GLP-1s in non-obese individuals. Problem or overhyped?
Big problem. You need to use the right tool at the right time. And I use these drugs all the time in people for the right reasons. But if you use them at too high a dose for too long, people will lose way too much weight. They'll lose muscle mass, they'll lose bone mass. You need to have a provider who knows how to use these.
Possible side effects like gastric paralysis, vision problems, anything else that you've heard in the 0.1% risk likelihood. Overhyped by media or a significant concern?
Completely overhyped, but not unreal. Let's just think about it. In terms of the eye problem, they're talking about a kind of blindness. That happens incredibly rarely in anybody. And when you take one of these drugs, it may slightly increase that risk. But look at what else it can do. It lowers the risk of blindness in people with diabetes. It could lower the risk for glaucoma, uveitis, and macular degeneration. 4 major eye diseases may be improved by these drugs. Say nothing of the other benefits. Reduces your risk of heart disease, reduces your risk of stroke, may reduce your risk for dementia, and helps your kidneys function better for longer.
GLP-1s in menopause, beneficial, possibility, or not?
Beneficial. Really helps women who are struggling with the perimenopausal/menopausal period in their lives. It's when your hormones change, you may start getting central weight. It's really helpful to not gain that weight, to lose that weight if you have it, and then to feel sort of more positive about things. I think it's really great to go through menopause because then all your hormones are gone and you can live the life you always wanted to.
I agree with that.
I am not opposed at all. But again, right woman, right drug. You've got to look
Right
through
management.
Things.
Right
very
provider.
carefully. Right everything.